7 warning signs that you may be at risk of a heart attack. That's how heart attacks in men are usually portrayed in movies, but it doesn't always work that way in real life. Although heart attacks can occur without any warning, that scenario is way less common than you think. Common heart attacks generally come with warning signs. Most patients do have symptoms prior to their heart attacks, says James Park, M. FACC, Director of the Heart and Vascular Program at Texas Health Dallas. But it's easy to blow off more subtle symptoms of a heart problem. The number of heart disease-related deaths increased to 840,678 in 2016 from 836,546 in 2015. This jump is attributed to updated guidelines for high blood pressure, which lowered the reading to 130/80ths of a millimeter Hg, from the previous reading of 140/90ths of a millimeter Hg. High blood pressure is a big risk factor of cardiovascular disease and heart attacks. This is why it's vital to take unusual signs seriously. You can catch a heart attack before it happens. Sign of potential heart attack: your erection falters. As Siegel explains, if your blood vessels down there are damaged, there's a good chance the ones near your heart could be damaged as well. When that occurs in the vessels to your heart, you could be at risk of a heart attack, he says. Sign of potential heart attack: your leg or hip cramps up when you walk. That discomfort is caused when not enough blood flows through your legs. This discomfort could mean your heart is at risk for potential problems, too. PAD is similar to coronary artery disease, where plaque builds up around the heart's major blood vessels. So the plaque buildup that contributes to the narrowing of your arteries in your limbs may also be occurring in arteries by your heart, too, according to the Mayo Clinic. And that buildup can significantly up your risk for a heart attack, says Park. Sign of potential heart attack: you feel sick to your stomach. But it can also signal a problem with your heart. The nerves in your gastrointestinal tract are closely intertwined with the nerves from the heart. As a result, a problem that could be brewing in your heart can sometimes translate as stomach discomfort, he explains. Usually nausea caused by an impending heart attack will get worse with physical exertion and ease up when you rest. Signs of heart trouble: you're bloated. This is because the heart is too weak to properly pump blood through the body, which causes fluids to build up throughout the body. Generally, you'll notice swelling in the legs, feet, ankles, legs or stomach, according to the American Heart Association. What to do if you experience heart attack symptoms? Unlike the classic crushing chest pain, these symptoms don't guarantee that your heart is in immediate danger. If your doctor suspects that a heart attack could be looming, he might recommend an EKG. A test measures the heart's electrical activity and shows if your heart is damaged. And if you experience any classic symptoms that signal you're having a heart attack right now, call 911 ASAP. Of course, the best way to prevent a heart attack is to improve overall health by lowering high blood pressure, maintaining a normal body weight, and abstaining from smoking. Mary Grace Taylor. Mary Grace Taylor is a health and wellness writer for Prevention, Parade, Women's Health, Redbook, and others.